Hi everyone, Mark Reyneker here of the Family Podiatry Centre. This is our first ever podcast, and for the first episode I needed to introduce myself and to just talk to the audience a little bit about who I am and what to expect in this upcoming podcast. So I'm a podiatrist by profession. A podiatrist is someone who specializes in everything involving the foot and the leg, so essentially the lower limbs of your body. With the lower limbs, a lot of it is controlled by what happens in the foot. So in podiatry, we tend to focus a lot on how the foot functions and how problems develop. And then we are also, of course, running clinics in which we treat the types of problems that occur. And we have many different types of avenues for treatment. We do surgical work, which typically involves removing ingrown toenails, removing corns, removing calluses, removing growths on the foot. Nowadays, excising a lot of foreign bodies from the feet, and all that sort of surgical things. But we do not practice bone and joint surgery where we do bunion correction or fusion of joints. This particular part of the foot is left to foot surgeons who are either podiatrists who have specialized in surgery or orthopedic surgeons who have specialized in foot and ankle surgery. So in podiatry, we deal with the surgical aspect is usually superficial, isolated to skin and nail, corrective in nature, or sometimes just palliative in nature. With regards to function of the foot, this is where I particularly specialize in. We look at how the foot functions, looking into movement of the foot structure, and how things go wrong. Currently, in the field of podiatry or in the field of foot function, there are multiple theories that govern how we think about things going wrong and which models we follow regarding pathology that then guides our treatment techniques. And there are different schools of thoughts and, as I said, different theories. And the theories that our clinic in particular uses that differs greatly from how basic foot morphology and disease is looked at is that we specifically look at the foot from a functional point of view, and that is speaking of how the foot comes together anatomically. So one of my other degrees that really enhances and gives me a bit more of a specialized view on the foot is that I have also studied paleoanthropology, specifically focusing on foot evolution and foot function. And when we study this particular way, we look and do a lot of comparative anatomy. So we would look at other animals in the animal kingdom who have feet that are similar in structure to ours, but maybe have a couple of variations that make that particular foot function in a different way. Then we look at our foot and see how a particular skeletal alignment is and how that functions. And in doing this comparative anatomy, we are able to compare and look at why a structure is shaped the way it is, and in that way we can infer function. So just to give you an example, there is a bone in our foot called the talus. Our talus structure, which sits directly underneath the ankle, our talus and how it is structured in a way that gives the human foot a very specific type of movement. But this particular talus bone is shaped very differently in primates. And when we have a look at that structure, we can see a very specific type of function. So if in the clinic I land up seeing a patient and on X-ray we find that this bone has a morphology or a shape that looks very similar to what we see in primates, not exactly the same, of course, but just has certain features that might look that way, that explains to us why this person's foot can or can't be corrected, or why this particular person's foot has resulted in a particular pathology that has led to the pain that they are complaining of. So when the foot deviates from what we consider to be normal anatomical alignment for a human and has other types of morphological features, we know that that shape will infer a certain function, so we know how to counter that in our treatments. This is very different to the old-fashioned way of looking at foot function, where people basically would look at a disease. That's where they will start off, and they will say, right, this person has plantar fasciitis. What is the treatment for plantar fasciitis? Let's give the foot some sort of arch support. Then when they give the foot arch support, they think that that cures the problem. But this is one of the reasons why plantar fasciitis is a condition that many people suffer with, and it goes untreated but does not yield success, and so people end up suffering it for very long. It's because the approach is more from the angle of looking at the disease first, which is the micro tear that occurs in the tissue, and then just having an answer for that, which is give it some sort of arch support. The other way of looking at it, which is what I specialize in, and I hope to share a lot of this knowledge as we go on through this podcast of how you can solve some of your own problems or help a friend solve their own problems, is that we look at this from a very functional point of view. So if you come to us with plantar fasciitis as an example, we start first of all just to diagnose the condition, but that condition is not how we provide treatment. We then go into analyzing what is your foot doing during your gait cycle. How do you run? How do you move in your day-to-day function when you're using your foot? And in analyzing how that foot works or deviates from what we consider to be normal, perhaps there could be something that's slightly off of alignment, inferring a particular type of function. So then we know, hang on a second, that particular function could land up overloading a tissue like the plantar fascia. We know that the plantar fascia has a certain threshold, and if this particular movement is in the foot, and we know it is associated with pushing the load or the threshold of the plantar fascia over what it can handle, then that's how you will result in this condition known as plantar fasciitis. And so instead of treating the plantar fasciitis, we then treat that underlying root cause, which then not only solves the plantar fasciitis in a matter of just a couple of weeks to months, but also enhances your foot function and prevents other structures from being overloaded. So this approach is a bit more nuanced. This approach is more holistic in addressing a problem like plantar fasciitis. We land up treating or preventing a whole lot of other problems from occurring in the lower limbs. And this is what makes this field that I am in so interesting for me, because we are always trying to find the underlying cause of a problem. And it's almost like being a little investigator, where you go into the foot and you try and find, right, this is the problem that this patient is coming in with. How do I break this down and find out what was the underlying cause? And so it's a step-by-step process that happens during a consultation, going through the data that we collect on your examination and then coming up with an answer for you. And this technique has yielded incredible results over the past 24 years that I've practiced. And this particular qualification that I have of being a podiatrist and also being trained in the field of paleoanthropology has given me a very different view on foot function, which I hope to share as we go along through these different podcast episodes. It is also very limited in the world. There are only a handful of people with this particular combination of qualifications. And so it makes what we have to say in this podcast very unique, very interesting, as we go on through foot function. So I will be presenting different topics, everything from how the foot evolved through the years, how it has changed and how it serves us now, how the foot is currently changing, how shoes affect our feet, how they might be enhancing our foot function or perhaps being a detriment to our foot function, how conditions arise that cause pain, and how you can look into solving them, either with home treatments that we can advise or by seeing one of our professionals in our clinic, or possibly consulting with me in other formats to help you. But we hope that in this upcoming podcast there is enough content involving selecting shoes, how to select your shoes, what pitfalls to look out for, exercise advice, how to look after your feet, how to prep your feet, how to strengthen them. And if you're someone suffering with foot pain, how to get back out there to do what it is that you would like to do. And if we are unable to help you through the podcast, at least you'll be able to learn a whole lot of new interesting thing about your feet, because it is truly my belief over the 24 years that I've done this, that it is such a misunderstood part of the body, and it is such a disrespected part of the body, just stuffing it into a shoe, and people don't think twice about their feet until they start to hurt. They also never look at the feet when they start getting knee pain, lower back pain, or aches and pains in other parts of the body. It is oftentimes the last part to look at, but as you will find out through this podcast, it is so important. And by giving it the respect it deserves right from the start, you are probably going to be able to save yourself from a lot of lower limb pain, including back pain and other types of problems, or maybe even learn to enhance the sport that you're involved in. So I really hope that you can join us, sign up and join this podcast, and we will do our utmost to bring other professionals up on here, anyone from orthopedic surgeons involved with the foot and leg, foot and ankle specialists involved with the foot and leg. We could get some other podiatrists to talk about their experience in treating and helping people. We can also look into some surgical aspects. So everything involving the foot and the leg, and we hope that you will be able to get help through this. If you are a student, you may also find some of this very interesting, because perhaps you'd like to start a career in this direction, looking at feet, because it can be a very rewarding career, and you may be interested in it right now, and after the podcast decide that this is not something you want to get involved in. Whatever the case may be, it is a source of information where you can learn, learn about things that you've never thought about, and hopefully land up applying it, and will help you in choosing your career. So a little bit of everything for everyone, and we look forward to seeing you in the upcoming podcasts. Bye for now.